Managing parental conflict and anxiety. Your patient is a young boy who has suffered a splenic rupture following a fall from a height while playing in the garden. His father has already given consent for the operation. However, the patient's mother has arrived later, extremely distressed and demanding to speak with a consultant. Your task is to speak with the mother, manage her concerns, and navigate the conflict in family decision-making.
Hello, I'm Ethan, one of the surgical doctors. I understand that you're very upset and would like to discuss your son's situation. Can we sit down and talk about it?
Yes, I want to know what's happening. His father told me he fell and now needs an operation. I don't understand.
I'm really sorry to hear that you're feeling this way. It's important that you're involved in the decision-making process. Your son has suffered a splenic rupture. The spleen is an organ located on the left side of the body, which might be why you noticed a bruise there. It has important functions in the body, including fighting infections and filtering blood. When it ruptures, which can happen after a fall like your son's, it can cause internal bleeding which can be life-threatening. The operation is necessary to control this bleeding and save your son's life.
But isn't there another way? Can't we avoid the operation?
In some cases of minor injury to the spleen, it's possible to manage without surgery. However, in your son's case, the rupture is quite severe, and non-operative management carries a high risk of sudden, severe internal bleeding. I understand this is distressing to hear, but the surgery is the best option for your son's health.
What are the risks of the operation?
As with any surgery, there are some risks involved. These include the general risks of anesthesia, infection, bleeding, and blood clots. There can also be complications related to the surgery itself, such as injury to surrounding organs. However, our surgical team is highly experienced and will take all possible precautions to minimize these risks.
I understand. But I wish I had been included in the decision from the start.
I completely understand your feelings, and I apologize if the communication process hasn't been as comprehensive as it should have been. In emergency situations, sometimes decisions have to be made quickly, but that doesn't mean your involvement is any less important. Going forward, I'll ensure that you're kept informed and involved in your son's care. Is there anything else you would like to know or discuss?
No, that's okay, for now. Thank you for explaining everything.
Of course. If you have any other concerns or questions at any time, please don't hesitate to ask. Our priority is your son's health and your peace of mind.